Bismillahirrahmanirrahim. Today we will have case quiz number 16. Case data: 55 years old male. Diagnosed as hypertension few years ago. Family history: his father has gout and hypertension. The patient complaining of single attack of pain and swelling at the right big toe MTB 6 months ago. Treated with non-steroidal anti-inflammatory drugs and resolved few days later with no recurrence till now. So one attack of acute gout until now. Physical examination showed temperature within normal 36.7 degrees centigrade, blood pressure high 160 over 100, so uncontrolled hypertension, pulse 82 beat per minute, respiratory rate 18 cycle per minute, body mass index 24. Investigations showed serum creatinine normal, serum uric acid elevated 7.9 milligram per deciliter, ESR within normal for this age, CBC normal. So, which of the following is the most suitable drug to be used for this patient? This patient is uncontrolled hypertension with history suggesting acute gout and family history of gout and hypertension with somewhat increased body mass index. So, which of the following is the most suitable drug to control this hypertension? Hydrochlorothiazide or lisinopril or losartan or metoprolol. Which of the following is the most suitable for this specific case? The answer is losartan. But why? We will see in the next slides. The educational objective here is to treat hypertension in a patient with hyperuricemia who is at increased risk for acute gout. The angiotensin receptor blocker ARB losartan is the most appropriate antihypertensive drug for this patient with hyperuricemia who is at increased risk for acute gout. Hypertension is a common comorbidity for gout and is found in approximately 74% of patients with gout, so it is very common in gout patients. Antihypertensive drugs have variable effects on serum urate level and the risk for acute gout. A population-based nested case control study compared nearly 25,000 patients with a new diagnosis of gout with 50,000 controlled patients. The risk for gout was assessed according to antihypertensive drug class. Losartan, especially, but not other ARBs, and calcium channel blockers were associated with the reduced risk of gout, with relative risk for losartan is 0.81 and calcium channel blocker 0.87. If you don't understand the relative risk, if more than 1 it means risk, if less than 1 it means protective. So the relative risk for losartan is 81 This means that losartan decreases the risk for acute gout by 19%. And for calcium channel blocker is 87, so it decreased the risk for acute gout by 13%. Both losartan and the calcium channel blockers lower serum urate. Losartan, like probenecid, interfere with the urate reabsorption transporter, thereby promoting kidney urate excretion. The mechanism by which calcium channel blockers lower urate level is unclear, but may be mediated through increased glomerular filtration rate and increased urate clearance. Based upon these data, losartan and calcium channel blockers are the preferred antihypertensive agents if reducing the risk of gout is clinically relevant. In the same study, ACE inhibitors and non-losartan ARBs, beta blocker, and diuretics were all associated with increased risk for gout. The absolute risk for gout was greatest with diuretics, with an estimated risk of 6 events per 1,000 persons per year. The key points here is the angiotensin receptor blocker, losartan by name, and the calcium channel blockers lower serum urate and may be useful to treat patients in whom hypertension and gout are both of clinical concern. And finally, thank you very much for your attendance, and we will meet you in the next future with case quiz number 17. Wassalamu alaikum wa rahmatullahi wa barakatuh.